If your pet is constantly licking their paws or scratching, they might have allergies. But the problem might actually not be their food. Right off the bat, most assume that the problem is the chicken or the grains in the food. I talk with pet owners all the time who keep switching diets without ever really making any progress. In veterinary medicine, food allergies most certainly exist, but a lot of times that's not the whole story. The internet is quick to blame foods, but they often bury the lead. The reality is that environmental allergies are a huge contributor in dogs too, something most people don't know. Environmental allergies are much more common than true food allergies in dogs. But why is this so misunderstood? Probably the biggest thing is pet food marketing. So many foods list things like limited ingredient and sensitive skin as features without ever really defining what that means. On top of that, the social media people push the food allergy narrative pretty hard. Symptoms often wax and wane, making it seem like maybe a food change helped, when in fact things might have been in the process of improving on their own. So what actually causes most dogs to be itchy? First and foremost, it's environmental allergens like grass, pollen, dust mites, mold, and more, just like in humans. But in dogs, instead of causing watery eyes or sneezing, these allergens can cause skin inflammation. Most dogs worsen seasonally, and this is why. These allergens are present in different quantities at different times of the year. How do infections come into play? Anytime the skin barrier is abnormal, secondary infections are much more common. Once yeast or bacteria begin to take hold, it can dramatically worsen the itch. It's quite common for allergic dogs to have frequent skin and ear infections. The infection itself might be the main driver of the discomfort. Red skin, smelly skin, that corn chip smell, brown ear debris, head shaking, these can all indicate infections. Flea allergy dermatitis is another often overlooked component. Some dogs get super itchy from even small flea exposures. Most owners think that they would see fleas or that the indoor pet can't get fleas. That said, pets can still get bitten by fleas even if they're on flea meds, and since the saliva is what triggers the itch, they can still get pretty itchy. And fleas can live in carpeting for years, so indoor pets can still get fleas. Food allergies absolutely exist, and the signs are indistinguishable from other causes. But most of the time, food allergies overlap with environmental allergies, and so even though your pet might be a little bit better on one type of food over another, it might be that the main driver of their allergies is in fact the environment. So what are the common mistakes pet owners make in the process of trying to do right by their pet? Constant food switching. This creates a ton of confusion. The first issue is that it takes a couple of months to see any improvement with a food switch. And just because you see improvement doesn't mean it's the food that helped. Getting a little bit better isn't a diagnosis. Allergy tests exist, but which ones are trustworthy? There's a lot of marketing pushing blood, saliva, and even hair tests, but vet dermatologists don't usually use them. As far as diet, the easiest way to rule out an allergy is an elimination diet trial, not tests. Ignoring flea prevention is the other problem. Any dog that comes to me for itchy skin gets consistent flea prevention no matter what. Flea allergies can look just like food or environmental allergies. Waiting to come in for itchy skin also leads to delayed treatment for skin infections. Often by treating the skin infection, we can make the pet much more comfortable, but that starts with getting a diagnosis and getting on the right treatment. So when you come in, what does a diagnostic workup look like? Well, the first step is going to be taking a thorough history. We'll ask if the allergies are seasonal or year-round, how old your pet was when they first started getting itchy, if they have lots of ear infections, what therapies have worked before, etc. We really need to know a lot of information to make a thorough diagnosis of what's going on with your pet. Following that, we're usually going to do some cytology. This means looking at skin samples, usually an impression smear or a tape smear, to see if there are excessive organisms like bacteria or yeast when we look under the microscope. We'll also talk about flea control, and if flea control isn't current, we're going to get that on track. Some of the newer flea and tick meds also cover very effectively for mange, which is a less common but still present cause of itchy skin. Elimination diet trials are the next thing we'll want to discuss. These require very strict adherence and usually last 6 to 8 weeks before we would see any improvement. It's quite important to avoid treats, snacks, table scraps, and the like, as this can invalidate the results. If symptoms improve, we reintroduce the previous food. If the symptoms come back, then food allergies become much more likely. Symptom control is critical because itchy skin reduces quality of life. We might discuss options like Apoquel, Cytopoint, steroids, topical creams, antibiotics, antifungals. The right medication for your pet depends on their exact problem and their overall health, but we have a lot of options to make them feel better while we're trying to figure out the underlying cause of their allergies. Knowing when to see the vet is important too. The main reasons to make an appointment are severe itching, recurrent ear infections, smelly skin, red skin, hair loss, excessive licking, trouble sleeping, or recurrent symptoms. Chronic itching is never normal for your pet. Common questions are whether grain-free or raw diets help allergic dogs. And in reality, the evidence is a lot more complicated than social media or food companies usually make it seem. When it comes to allergies, food is easy to modify, but environmental allergies are a much more common cause. It's always best to work with your vet if you want to really get your pet's allergies under control.